I'm Dr. Jonathan Clark, and I'm here today to talk to you about whiplash and injuries from car accidents. Perhaps you've been involved in a car accident and you went to the emergency room afterwards and they did the necessary tests and procedures. They did x-rays on your neck, spine, found there's no fractures, there's no dislocations. Everything seems to be okay, and they give you a script for pain medication, send you on your way. If things continue to persist, they said to follow up with your doctor afterwards. Well, let's say perhaps a few days go by and things really aren't getting any better. Your muscle aches, tension in your neck and spine are getting worse. The headaches are increasing in intensity. You might have to start to develop numbness in your hands and fingers. You might even start developing some dizziness, which is associated with these type of accidents. So you follow up with your doctor. Doctor examines you, says, well, let's try this pain medication instead. Might even send you for some therapy. The problem with this is a few days, or weeks, months go by, and there's really been no change. Things might have even gotten a little bit worse. So you go back to your doctor says, well, you need to see a neurologist now. So you get examined by the neurologist, he takes an MRI, the MRI comes back negative, so he doesn't really know what to do with you, gives some more pain medication, also suggests to you that it may be in your head now because you're a chronic pain patient, so learn to live with this. That's happened all too many times in our office. We've had patients come in telling us that they've just been given medications and told to learn to live with it. At the same time here, the problem is all these bills are piling up. You're having problems at work. You're having problems with your family. You're in chronic pain now and you can't do the things that you used to do in the past. And the bottom line is this wasn't your fault to begin with. You were rear-ended by somebody else, but now you're stuck with these problems. So the main thing is we need to address the cause of this problem. And we can't fix something unless we know what the cause of it is. So in this case, if we take a look here, we've got a side picture of the spine. We've got our vertebra here, our individual vertebra, and in between them are the discs, are the pads between the joints that give shock absorption. When we're in that kind of quick hyperflexion extension injury where the neck is moved forward and backward quickly, you can injure the surrounding soft tissue that goes in the front of the spine here, the ligaments in the front, and the ligaments in the back as well, in addition to misaligning the actual joint itself. So what we need to do is we need to get some stability in this area. The joint needs realigned before we can really start doing a whole bunch of other rehabilitative procedures. It's kind of like if your car is out of alignment, you try and fix it by driving it faster. It's really not going to make much sense. So again, the alignment needs to take place first, allow this soft tissue surrounding it to heal, then we can get where we need to be. So in our office, we're actually specialists in these types of procedures. We're the only physicians in the area certified by the Spine Research Institute of San Diego, which helps us deal with whiplash and what we call brain traumatology. So you don't want to let this turn into a long-term problem because it can. Again, chronic pain can often turn into a long-term problem, and patients will maybe doing okay for a while, they'll settle their case, and then their pain comes back, and now they're stuck with the bill because they settled their case too soon. So don't want to let this turn into a long-term problem. And don't think to yourself, maybe it'll go away, because the symptoms won't go away, again, until you correct the problem. Something only goes away when whatever's causing it goes away. So if you're frustrated with your chronic pain from your accident, I want you to know you've come to the right place.